Assalamu alaikum wa rahmatullahi wa barakatuh, and a very good evening right here from Kenya's capital. I'm talking about the Nairobi metropolitan, the capital city. Well, tonight we will be talking about the coronavirus second wave. My name is Feisal, Kassim, and welcome to Live Real Talk. With me in studio is the chairperson of the National Muslim COVID-19 Response Committee, Professor Muhammad Karama. Thanks so much, Professor, for making time for us.
Thank you.
Now, the total figures as of today stand at 53,345,270 people who have contracted this virus, coronavirus, of which the death stands at, I beg your pardon, the death rate, the total number of deaths is at 1,303,072, and the total persons recovered is 37,350,300. Now, just if you allow me to look into our country, Kenya, as of today, as of right now, what are our figures? And I'm looking the total number of cases in Kenya so far is 68,193. Right, total number of deaths is 1,228. Total recovered 44,872. Currently, the active cases as of today stands at 22,093. Seriously critical stands at 54, and total number of tests that have been carried out in the country stands at 774,982. These are just but the figures that we are looking at in this country for as far as this COVID-19 is concerned. Now, Professor Karama, from where you are sitting, being the chairperson of the National Muslim Response Committee on COVID-19, and of course you're also a scientist who's practiced research at the Camry for quite a long time. This virus, the way it is, the recurring of this virus, one, we just need to understand, is it a recurring virus, or it's just the virus that has come back a bit, the same virus that has come back a bit stronger? Professor.
Thank you very much. Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Alhamdulillah. Wa salatu wassalamu ala Sayyidina Muhammad wa ala alihi wa sahbihi ajma'in. Amma ba'd. Thank you very much. We need to understand that this virus is, we would say, a mutated virus, and that means it's a virus that existed before in a different form as SARS, SARS, which we can refer to as SARS-1 maybe, because we are now referring to it as SARS-2. We had corona a long time in China, in other countries, in the Middle East. And we need to know that this is a zoonotic disease. It's a virus that exists in animals, and it changes its structures to be able to infect human beings. And therefore, it is not a new virus, but it changes its structure from one form to the other. And by so doing, we now get a new version of the virus. So when we say COVID-19, it's actually SARS-2, but then COVID-19 is the disease. However, I want to clarify that most viruses have a tendency to change its structure. So even the current virus, we may have different subspecies. It adjusts itself to fit its own situation to survive in infecting human beings and trying to overcome any new adverse effects on them. For example, if there is a new treatment, they try to adjust to overcome some of this. So it's a well-known fact that these are zoonotic infections. The earlier virus that had occurred in China, maybe in 2002 and so on, was associated with civet cats. you know, the feline family of animals. And the second type later on, when we got the corona in the Middle East, which was referred to as MERS or MERS, Middle East Respiratory Syndrome, these were associated with camels. And therefore, currently we are looking at this disease having started from China as a result of maybe bats or any other mammals that the Chinese must have used, and then the mutant virus, which is now SARS-2, got spread to all over the world. So it's not a new virus, but it's a virus that has reformed itself to be able to infect all the world over.
So you mean to say that there are some sort of differences between the virus that was spreading before in the form of SARS and the current one that's spreading and what is popularly known as the second wave? Is there any slight of a difference? Because you are saying that it is a mutating virus, so meaning to say that there are some slight changes, correct?
Yes, it's a new virus in the sense that people have come to know the different effect or symptoms of the disease. This disease, unlike the previous ones, the coronas, they affect very widely, although with a lower mortality rate, but they affect many people. Unlike the other Middle East respiratory syndrome, it was not very infectious, but it was highly, the mortality rate was much upsurge than we are experiencing now. But when you are talking of wave 2, it's a sudden upsurge of number of cases related to many factors. One is the expectation that was there, that people would have the herd immunity, which we might discuss later, and that people will have immune levels rise. This is not the case, and therefore when people got a bit relaxed, and I want to talk about our own community, especially the Muslims in this country, we over-relaxed, we over-ignored the regulations when an impression was given that the situation was getting better. And so we had an attack, and this has happened in all other countries. A sudden upsurge of this infection just by a simple release of feeling that we are now secure and people abandoning the control measures that were put in place. And in some countries, they're even talking of a third wave, for example, after changing of the behaviors of the people in understanding the transmission patterns.
Professor, I just want to understand this thing before we move on. For as far as the second wave is concerned, one, I think I asked this earlier on, was it bound to happen either way? Is it part of the phases that we're supposed to see, the first wave and the second wave? Because I remember a country like Sweden, when you were talking about coronavirus during its first wave, they were saying that they were not taking the restrictions like the rest of the countries in the world because they were preparing and trying to prevent the second wave, which might hit harder. So the question here is, was it bound to happen either way? Or is it because we relaxed, that's why the virus came in and we're looking at surge in numbers and positive cases rather?
I would say it's really both. Some countries had the chance to do mathematical modeling of the way the cases were coming up, and they could project that there would be a second wave. if certain control measures were put in place. And therefore, some countries, maybe in Europe, were able to project that it is likely that this disease, when the immune level is not increasing and people get the fatigue, pandemic fatigue, they are likely to get more cases to develop. Some people looked at it that way, and they were prepared that way. However, in our setting in Kenya, we were looking at flattening the curve. In other words, we are looking at the immune level increasing, and that we will reach a point that we will reach the peak, and then it will start coming down. But this was based on the fact that the coronavirus will reach a point when there will be herd immunity in the community. Unfortunately, the development of this immunity amongst our community was not that fast. So the antibody buildup was not as anticipated. Therefore, this herd immunity was really an expected, an assumption that that would happen. So when we assumed that the cases were going down as an effect of very good control measures, then we relaxed our rules. So that's the second thing, that because of relaxing, we got into the second wave. However, in Kenya, we were not expecting the second wave. We were expecting that the situation will get better, we will flatten the curve, and the cases will start going down.
Interesting enough, Professor, you've brought in another angle of the conversation that's quite interesting. We have from a reliable source who prefers anonymity that when the numbers appeared to be lower and the curve appeared, quote unquote, to be flattening, it was majorly because the number of tests had reduced immensely. So it is not that really the positive cases had reduced, but it's just because those who were tested were fewer compared to those who were tested before. I don't know from where you're sitting if you can either confirm nor deny the accuracy of this statement, Professor.
I have said time and again that epidemiologically in this country we never got to know exactly the situation, the infection rate in the country, because our system in the early stages were very centralized. Our sampling design was not randomized to be able to say this is the country situation. We were looking at cases, we were following contacts, and this is what gave us the indication of the infection rate in the country. It could not have been very realistic. We did not know the rate of spread of this virus in the country because many counties appeared to not have any infection until in a much later stage where all the counties now appeared to have infection. This only appeared to be known when we now decentralized our testing capacity. When we increased our testing, we could get a kind of a guided picture of how many cases are coming from which testing base. So we are now having a much more realistic picture of the situation in the country. In the earlier stages, as you said, it was based on the number of samples. At a certain point in time, we did not have adequate testing kits, we didn't have reagents, and therefore the number went down. Definitely, the cases appeared to be going down, but it may not have been the real picture. It was just that we were not testing adequately. Wow. And in this COVID, the number of cases tested puts a country ahead of the disease by knowing and identifying and controlling those who are positive.
Wow. Thank you so much, Professor Mohammed Karamo, on that detailed, comprehensive answer. And that's how we take it on a very extremely short break, because we have quite a lot to talk about. When we come back from the break, we need to know about the culture that Professor had said, that we have relaxed our culture. When we started the COVID protocols. All mosques in the country were observing at least the physical distancing, the hand washing, the hand sanitization. Talk of everyone carrying their own prayer mats. But is it the case at the mosque near you or in your locality or where you work? I doubt so, because we're going to talk about that. Let's talk about the political culture. You know, a lot of people are actually benchmarking from the politician, what they have been, from the politicians, I beg your pardon, what they have been doing, right? And they were benchmarking from that. Actually, we are pushing the committees of the mosques to open the mosques fully, without social distancing, without observance on masks and everything. Why? Because we are seeing political rallies all over until His Excellency the President banned the political rallies. Last but not least, we would like to talk about the vaccine. These and many more right after the break. Please do not touch that dial.
الله أكبر الله أكبر الله أكبر الله أكبر أشهد أن لا أشهد أن لا إله إلا الله أشهد أن محمدًا رسول الله أشهد أن محمدًا رسول الله حي على الصلاة حي على الصلاة حي على الفلاح حي على الفلاح الله أكبر الله أكبر لا إله إلا الله
Horizon TV, the beacon for the nation. On the next episode,
Even without coming to his attributes.
Yeah.
Who is God? Is there a God? I know there are those who say there is no God, or who doubt the existence of God. But we like Muslims when they say there is no God but Allah.
And
I think we disagree when they add Muhammad. We disagree when they add Muhammad. And I think I want to pose to you, why do you add Muhammad?
Yeah.
I mean, when you mention God.
We call it now the Shahada. For you to be a Muslim and accept Islamic principles, you have to accept that there is only one God, and Muhammad is his prophet. And we say Muhammad because he is the prophet of the Ummah now. Previously, before him, when it was still time for Jesus, then it would be none to be worshipped but God, and Jesus is prophet.
Kwa majina anaitwa Muhammad Sam Obura, ndio alikuwa ananipa uelekezi au mwelekeo. I don't know, I hope my Swahili was right. Thanks so much, Muhammad Sam Obura, right there on the director. I hope my Swahili was right this time. Mwelekezi wangu katika usiku wa leo, Muhammad Sam Obura. Thanks so much. Now, we are talking about the second wave of COVID-19 right here inside the studio. And we are privileged and honored to have the chairman of the National Muslims Response Committee on COVID-19, Professor Mohammed Karama. Thank you so much once again, Professor, for making time for us this evening. Professor, we're still on the matter of the second wave of this COVID-19, and you say that one, we lowered our guard, and two, we have changed on our culture, and that is why this virus is coming and seriously attacking us to the core as a people, as a community, as a country. Part of the steps that we had taken as a community, and in particular the Muslim community, was the closure of the mosque, closure of the madrasa. And when the mosques were reopening, of course, under the guidance of the Interfaith Council, they were supposed to be opened in phases. First one was supposed to bar some people from a particular age not to access the mosque. And those who were accessing the mosque, they were accessing in a limited number. And there were some protocols that were to be adhered to. One being the face mask, which was compulsory. Secondly, you're supposed to carry your own prayer mat. Third, you're supposed to observe the physical distancing between you and the next congregant. Fourth was supposed to be about the number of minutes or hours spent inside that particular house of worship. Five was the removal of the scriptures, the Quran, the physical copies of the Quran from the shelves of the mosque. Six was no handshaking, no hugging, no physical contact within the mosque, among many other. That is for as far as worshipping inside the mosque is concerned. Over and above that, we have our weddings, we have our funeral rites that were limited in terms of number. But when the curve appeared to be flattening, then some of these restrictions were relaxed as a people, as a community, Professor. And majorly was because the curve was flattening. The culture changed, Professor. What do you think would have led to some of these things?
Thank you very much. As a response committee, we had a number of issues, and the government, we worked very closely with the government to be able to actually come up with guidelines that were put forward to the people. One was the closure of mosques. We got to understand that the 5 daily prayers, the mosques, could have been a very big risk. And based on the Islamic principle of prevention and maintaining good health, it was accepted that mosques should be closed and other prayer places for Christians and others as well. And that was very useful for that period of time. But then the pressure to retain that guide continued mounting as people assume that the disease is kind of denying them the right to worship and so on. And the government had to give in the guidelines. And when the cases were coming a little less, which was not based on a very proper national outlook, therefore the mosques were reopened. And it was a very well stage-based reopening. They opened with a very few members to be allowed, an increased number, a few restrictions. The elderly should not come above, it was 68, then it went to 65, and so on. Then we said people with predisposing factors, like they should not, people with other conditions should not come to the mosque. And when the so-called flattening the curve came in, a lot of these rules were relaxed. When the numbers of people who were allowed to come into a prayer place were put forward, from 100, it went to 200 in a gathering, then it became open. It is in accordance with the opening of the space available with the social space. This was one of the issues that was the first one to be abused by our own people. Some alleged that they did not have good concentration in their prayers when they observed the social distance, which is not true. According to the guidelines, al-khudur al-qalb, the putting your heart into what you're saying, whether you are closed up or spaced up socially, is what will guide your khushu' in salah. It's not that closeness and so on. That was one of the mistakes that was done. In the coast and in the predominantly Muslim areas, this rule was flouted. Nobody was observing the social distance, and that was one of the challenges. The second one was the handling of the dead. We have experience from other countries and with the other diseases where many people died, especially Ebola in the West African countries. A lot of Muslims died because the issue of handling the dead was not observed adequately. And by the time they discovered it was a driving force towards massive transmission of the disease to the Muslims, it was a bit late. So we put mechanism in place right from the inception of this disease that we should observe the handling of the dead, and that we should protect and prevent transmission to those who are living. Unfortunately, with the flattening of the curve, that now is not being observed. People, relatives are taking their bodies, confirmed COVID cases, they're taking them to their houses, they're washing them, they're doing everything that is possible without any protective measure. This is contributing to the increased number of cases amongst Muslims. We are suggesting that that should not be the case. Schools are being opened, and opening of schools, no adequate infrastructure has been put in place. For example, it would be very useful to test all teachers before the schools are open, and to continuously observe children in the place, and put some controls amongst the students so that the younger ones do not change masks and things like that. And some very clear points should be put that in place. And if we look at our Muslim madrasas, we are even in a more worst situation, because there are no infrastructure at all. And worst of all are the gatherings, the social, the political, and the religious gatherings that we have. There is a tendency to believe we are protected by Allah, so even these gatherings that we attend, we will not be able to pick COVID. While the teachings of Islam is خُذُوا خِدْرَكُمْ وَلَا تُلْقُوا بِأَيْدِيكُمْ إِلَى تَهْلُكَةٍ, which means do not put yourselves into disaster, and also take precautions and then rely on Allah subhanahu wa ta'ala. I am very sad to say that Muslims now in this so-called second wave are hard hit in areas which we did not have the disease. In Malindi, in the northern region, in Nakuru, in Kisumu now, the Muslims are very highly affected. We had a mosque that was handling about 13 cases in one day, 13 deaths. This is very, very sad.
Wow.
Thank you.
Wow, Professor, that's quite sad. Partly, can you say the politicization of this virus has caused the relaxation mode? Can we blame it partly on the politicians?
Yes, it's a contributing factor, because many people were arguing that the politicians were having big rallies and big gatherings without any fear of transmission of the disease, and successes of the rallies were based on the big numbers of people who attend to listen to the politicians. At that time also, these guidelines were put aside. Many people who attend those rallies were not masked at all, and we believe a lot of transmission took place because there are many asymptomatic cases, but those asymptomatic cases, they would also be transmitting infections. So I think it is not politicizing the pandemic, but the behavior of the politicians that influence the relaxation to observe the guided regulations.
Thanks so much, Professor, for that. Again, just looking at another contributing factor was the corruption that's alleged to be connected or intertwined with all these COVID pandemic fiasco. COVID millionaires, so they say. Professor, people have been affected, livelihoods have been affected with this pandemic. People have lost jobs, others' businesses have gone super down. So people have decided to go all out and partly forget about some of these restrictions because it's not working on their favor economically. And on the flip side, the politicians are reaping big. The rogue people, the rogue officers within the government's corridors are reaping big in terms of millionaires. So people have decided to pick livelihoods over lives. I was with one medical practitioner who is in one of the humanitarian organizations. And she said that at this point, she would rather go out, and this is just her personal sentiment, that she would rather just go out and live life. Why she chooses livelihoods over life? So, because either way, people have been dying all year round. And this is just one among millions of Kenyans who are thinking like this. Either way, people have been dying all year round. Cancer, malaria, hepatitis, name them. All these diseases. Either way, people have been dying all these years. So it's not something new. I don't know what we can tell such people who have seen the money being siphoned and they've been asked to stay at home, right? And their livelihoods, their economies are not, their economic lifestyle is not working so well for them, right? So people have decided to go all out and chase for the livelihood, Professor. I don't know what you can say about this.
Your question is quite loaded in relation to the COVID millionaires, and then the attitude of people, including medical workers and others who feel like they are denied the opportunity to go out and search for life.
Yeah.
I want to say that today one of the worst things that is happening is at the expense of the healthcare workers. Just today, we are aware that one of our brothers, a medical surgeon, passed away with COVID-19 because he could not get the services, the intensive care unit services when it was needed, and he died. And many of the healthcare workers are being infected because the government is not providing adequate protective measures and protective equipment to these people. Today we are talking of over 400 or even more of the healthcare workers who have been infected with a mortality rate of some kind, while people are taking the money that was supposed to provide them with support, with sufficient protective equipment, with sufficient insurance cover. This is very, very sad, and it's very unfortunate. We are aware that many efforts are being done to curb this behavior, but I think it's a very sad part of our history and story that at the expense of the lives of the people that we are building up millionaires. Right now there's again a rush for contracts from KEMSA to supply some goods and so on, and some of these are still going on. It is very, very sad, and my appeal is to the government and to those who are in authority. They must know that one day they are going to answer for their misconduct. They are going to be charged. If it is in this world or in the next, they will have to pay for the damage that they have done and for the injustice that has happened. Secondly, I want also to say that in the early stages of this pandemic, I think our system, our law enforcement went out of their way to mishandle the people that they were supposed to protect. They killed people, they maimed people, they clubbed people, they beat people, they indignified people. People were buried in holes that were called graves. This was very sad, and I feel this contributed a lot to the polarization of the government and the people. And the government has to get out of its way to reclaim ownership of this disease by the Kenyan citizenry. Right now we are all concerned about the political whatever, and COVID-19 is a second hand, is no longer getting the priority it deserves, while the people continue dying and people in the healthcare system are not adequately paid, protection is down. This is very, very unfortunate, and therefore corruption has to be addressed. Those who have, we are reading in the media that the government has lost over 240 billion or so through this corrupt practice. You just can imagine how much can be done with 240 billion if it was to be used in the lowly placed Mary and Mariamu of this country.
It's truly quite sad. Again, thank you so much, Professor, for that. Now, Professor, on to the last part of our conversation this evening on matters vaccine. Different countries have gone out to test different vaccines, the latest one being Bahrain, of course, following after Egypt, Jordan, among many other countries, especially in the Arab Peninsula. UAE as well goes into the same list in spreading the vaccine. Actually, and I caught, this is from Reuters, Bahrain has granted emergency approval for the use of COVID-19 vaccine candidate on frontline workers from Tuesday. State news agency BNS reporting the announcement by the health minister. Looking at it from other parts of the world, we're looking at Switzerland, which have started rolling the review of Moderna COVID-19 vaccine. Different countries have gone out to try out this vaccine. And yet, we all saw the reaction of our health CS, CS Motahi Kabgwe, on the same discussion of vaccine. As a country, how far are we on this vaccine debate?
I think we have institutions in this country that have started testing some vaccine. But I want to talk about the vaccine and the processes that are involved and the concerns that people have with regard to vaccine. When a vaccine is developed, this would be through identification of the virus and looking at the antibodies that build up, and looking at a virus and seeing how the virus mutates, changes itself, and trying to get a vaccine that will be able to work on all different subtypes of the virus. So the process that is involved is lengthy. It has to start by getting the right viruses, to look at the antigens that are working, and looking then at how to moderate them, what kind of dosage, what kind of toxicity is there, there are many modalities to develop a vaccine. And therefore, it is a worrisome situation that some countries have come up very quickly and demanding emergency approval for this. There are certain levels of the testing of this vaccine. It should be done first of all in mammals, and then it should be done in small samples of human beings, and then it should be done in slightly wider groups, and then understanding all factors that are associated, toxicity, appropriate dosage, the length of duration of protection, the kind of immunity that is developed, and so on. So there are many factors that are associated with this. So when Kenya, we are working in partnership, and many countries are working together because it's a very expensive venture. So many countries team up together to share knowledge in the process of building up, to speed up this vaccination issue. And we in Kenya, we need to be very, very careful which country that we work with and how reliable it is. Because in some countries, this vaccine could be a live vaccine. That means introducing the virus in our bodies to attract immune system of our body. Sometimes it may result in the disease. And sometimes we also do live attenuated. In other words, the strength of the virus is reduced just to trigger up the immune system. So there are many factors, scientific factors, that needs to be looked into in terms of vaccine. We know countries like Britain, we know countries like America, Russia, China are going. China now selling their product to India. We need to be well informed. I heard the Minister for Health saying we are not going to rely with the American whatever, but there was no scientific base. I think we need to be well guided which vaccine we use and how that process. Our scientists must be involved in looking at that. And as Muslims, we are also in consultation with our brothers in other parts of the world to see what vaccine has worked, and then we can advise our Muslims accordingly. Thank you.
Well, thank you. Thanks so much, Professor, for that. Now, as we are wrapping up this conversation this evening, Professor, we've touched on the culture, we've touched on the lives as opposed to livelihoods, we've touched on the herd immunity, we've touched on the lowering of the guard, we've touched on the vaccine, we've touched on the virus as well, the mutating part of the virus. Professor, what would be your final take to our viewers who are watching us this evening in terms of advice to them when this virus is appearing to be hitting us again, and it's actually hitting harder than before? What would be your advice to them?
My advice is that Muslims are dying in big numbers because we have relaxed the rules. Some people say that after all we are bound to die. You should die by contributing to the betterment of the Muslim society in this world. You should not die because you're careless with COVID. And you cannot die definitely if your time has not come. But we need to follow the teachings of Islam, that we need to take caution to sustain our lives. And when death comes, you have done the best you could do to sustain life. Somebody was telling us one of the best principle, or the highest principle in Maqasid al-Sharia, is the protection of the nafs. Therefore, we need to go out of our way to prevent ourselves from getting these infections. We should not be seeing our people dying and not taking any precaution. The mosques should retain the distance, the social distance. The masks should be there. Water points should not be open. Only emergency cases for the elderly. The elderly should not go to the mosque because they will expose themselves. Those who are sick, who feel not very well, should not go to the mosque. And if we go to the mosque and any other religious function, we need to be protected. We need to be having the masks. We should not. We should prevent. We should reduce the eating in public places and so on, because that exposes us excessively. The opening of schools, the handling of the dead. We are there as COVID response committee for Muslims. We can support, we can guide. We have people in all the counties. Why should our people be infected by handling the dead? The experience of other countries in West Africa and other places has shown that by handling of the dead carelessly, the cases infection was transmitted. We want to say that please take precaution. Do not relax the rules now. All the pending weddings for the last few months are now being conducted in November and December. I think we need to be very careful how we handle COVID-19. I think we also need to rely on Allah subhanahu wa ta'ala. Once we have been able to do our part, then we can pray to Allah to protect us against this infection.
Wow, thank you so much, Professor. And onto our ticket to slumber this evening. This has been real. It was an amazing topic of discussion. Of course, a lot of wisdom oozing out from the professor this evening. And thanks so much to all those who sent their texts. Of course, we're sorry we did not get enough time to read them, but our ticket to slumber this evening, I know I've said this before, but allow me just to say it again, because it appears or it looks like the point is not at home. When we are having this conversation about COVID-19 and the reoccurrence of this virus, or the second wave, or the surge in numbers, one thing that came out clear out of the numerous discussions I've had with different clusters or different groups of people is that ultimately this COVID-19 has been reduced to a personal responsibility, and even the president himself reiterated that it has been reduced to you as a person. You know how to keep away. You're not supposed to be having physical contact. You're not supposed to be walking without a mask. You know you're not supposed to be in congregations. You know the do's and don'ts, basically, because they have been sounding like a broken record since March in this particular country. To an extent, the government has put a special unit just to enforce some of these things that have been put in place to protect us from contracting this virus. Now, many of us have relaxed and have gone out of our way. Why? Because the politicians are doing this. Why? Because the COVID millionaires are doing this. The government is doing this. So why should I? Right? And now, when the virus is spreading again fast, we are pointing the finger to the government that they're not doing enough. They're not spending the money rightly. Many people are dying. Where is the government with their investments in the health facilities, the UHC, among many other things? But remember, when you're pointing this finger, then there are three fingers which are pointing back at you. So which means you may be having a role to play in whatever is happening. An amazing quote by Steve Maraboli says that the reason your life stays the same is because you think everyone else is the problem. Stop pointing fingers and stop blaming others. Your life can only change to the degree that you accept the responsibility for it. So you think about it. What is your role in the spreading of this COVID-19, particularly the second wave? or what can be your role in stopping the spread of this serious virus? A disclaimer. Some of you out there might be strong and having good immune systems that this virus, even if they affect you, then they won't really take you down. But ask yourself, how many people do you interact with who are vulnerable or their immune is weak? Your grandmother, your father, your mother, your kids, maybe asthmatic, high blood pressure, among many other things. How many of those can you interact with? How many of those can you spread this virus to? Ask yourself that question. This has been the Live Real Talk. Thank you so much for keeping us company for this whole hour. Thank you so much, Professor Mohammed Kamal from the National Muslims Response Committee on COVID-19. Thank you so much to all the staff and the team of the Live Real Talk crew for making this a possibility tonight. See you next week, same place, same time, another interesting conversation right here on the Live Real Talk. I've been your host, Feisal Kassim, and Assalamu alaikum wa rahmatullahi wa barakatuh.
قال تعالى في محكم تنزيله بعد أعوذ بالله من الشيطان الرجيم
Ninasaha kutoka pwani.
هذا الدين قال الله قال الرسول قال الصحابة هم أولو العرفان انتهى.
Ili kuongoza kwenye njia iliyonyoka.
Sikizeni hadithi hii ya Mtume alayhi salatu wasalam.
Hakuna atakayeweza kumfungia mtu mlango ambaye Mwenyezi Mungu alimfungulia.
Kuimarisha imani yako.
ثبت قلوبنا على دينك وعلى طاعتك.
Ungana na mashekhi wetu kutoka pwani kwenye mimbar.
Mimbar zinamwakilisha Mtume sallallahu alaihi wasallam.
Ni Jumamosi na wakati saa 3 usiku katika Horizon TV, runinga uipendayo.